male, known case of type 2 diabetes mellitus on oral hypoglycemic drugs. Diabetes control is not known. He presented to us in OPD with chest pain on exertion CCS class 2 for 1 year and increased for 3 weeks. His echo was done, which was normal, and his ECG was normal sinus rhythm with no acute STT changes. So ETT was planned on OPD basis, and during ETT he develops symptoms of chest pain 4 minutes after exercise and ECG evidence of ischemia as well. So he was admitted in ER as unstable angina. So angiography.
Do you agree with this is unstable angina?
Sir, this is not actually unstable angina. This is stable angina because we put him on exercise. So in unstable
Why
angina.
we put him on exercise? Because you said that he had CCS2 angina with increase in intensity for last
3 weeks.
3 weeks.
Yes, sir.
So what was that increase in intensity?
Sir, increase in from CCS2 to CCS3.
So do we subject a CCS3 patient to stress testing?
No, because he is giving typical history of angina. We will not do ETT in this way.
One condition in which you can, if you have after like this, there is a patient who's in CCS2 for year, and for last 1 week is having or 2 weeks CCS3, and what you look for aggravating like anemia, tachyarrhythmia, infection, or you think there is something new which can be reversed.
Yes.
So just optimizing treatment, taking care of that aggravator, and further optimizing your treatment. And once you brought this patient to again CCS 1 and 2, then you can subject to stress testing.
Yes.
What kind of stress testing that it was? On meds or without meds? With medication or without medication?
He was on medication.
No. I am just asking you that scenario which I have given to you. Patient with stable CCS2, unstable CCS3, with medication, you again brought him to CCS1. Now you want to assess potential ischemic risk because you have brought this patient in terms of symptom to low risk.
Yes.
But you don't know exactly what's happening in coronaries.
Yes.
So now you want to assess that risk. So would you do stress testing on medication?
In this case,
or
we
without
will.
medication?
I think in this case we will do on medication.
Very good. Why?
Because now we want to find out the ischemia risk with medication.
So we are not doing this stress testing for diagnosis. This off medication stress test is for
diagnosing.
you are unclear.
Yes.
Is it ischemia or? So you want your patient to optimize the heart rate. Here you just want to see on your optimum medication what is the functional class this patient can achieve objectively.
Yes.
So it should be on medication. That's the way to go about this kind of patient. Here, so that means we need to know prior to that stress test whether it was on med or off med, because we know that this patient has disease.
Yes.
और आपने किसी मरीज की अगर बीटा ब्लॉकर रोक के 24 घंटे 48 घंटे उसको सब्जेक्ट किया तो वो तो स्ट्रेस टेस्ट के बगैर ही एंजाइना कर देगी. So was he subjected to stress test without medication or with medication?
Sir, he was taking medication. I'm not sure about the beta blockers. I didn't ask mom.
In that way, I think still what we can do, because if his LV function is normal, because someone is having angina with LV dysfunction is different category, then you need cath. But if patient is having angina just from 2 to 3 or without medication on stress test of 4-5 minutes, you can still opt for optimum medical treatment, see what happens afterward. So stable IHD is now a very difficult entity to go for cath unless and until you have optimized your full medication. If in doubts, you have done stress test. So these three combinations in stable IgG, especially with normal
LV
LV
function.
function.
If his LV is down, then
You
we will
have
go
to
for
look
LS.
for in stable IgG with normal LV function, optimized treatment first. Optimized treatment means rate properly controlled, baseline 60, pressure properly controlled, systolic less than 30, sugar properly controlled, adequate nitrate. These are the main first and second line anti-angel or calcium channel blocker, but we usually, along with beta blocker, use nitrates,
Yes.
long acting. Then you see your patient is CCS1, you can't subject this patient to that. Or if you have doubts on med stress test. So this three combination symptom stress test will give you the level of functional class of your patient on
On
optimal.
medication.
If he has a very good functional class, even with CCS 1-2 angina with medication, your intervention won't give you a mortality benefit. Unless and until I personally believe in those patients who have a very strong family history of sudden deaths, or you have any doubts of that left main involvement, you can do CT because
CT
these are
angiography
the studies for optimum medical treatment versus intervention. They have excluded the patient with
with
left
left
main.
main
So
disease.
that
Yes.
is just important.